There are a variety of reasons why addiction can often occur in older adults. Renee Cleric has joined us in the UH Broadcast Center to tell us these reasons and the action that must be taken to overcome addiction. Renee is the Program Manager of Addiction Services at University Hospitals. So welcome to our show here today. And aging itself can actually have some effect on addiction, correct?
Aging can, with the body, the CDC recognizes that people over the age of 65 have inadequate treatment for pain. So that's in both opioid and non-opioid medication treatment. So one of the problems is renal insufficiency that occurs in people over 65, and also the inability to clear medications. So then you have a smaller window for dosage, and you possibly have medications building up in their system, which would diminish their respiratory drive, or they would overdose because they can't clear that medication. But most of these people probably in the past 65 years of their life hadn't been exposed to this type of medication. And there's some very powerful pain medications. And as we know, that addiction is a chronic disease, but it also has a very large genetic component. So if you have alcoholism in your family, any genetic propensity for addiction, that if being exposed to these powerful medications, the same may happen to you after a period of exposure.
Okay, wow. So older adults also can have a problem with hidden alcoholism.
Yes, actually, that is a problem with older adults because they don't usually realize what's happening to them. And I see two cases of that happening. One, someone that would be a prior alcoholic that quit drinking a long time ago. Something happens in their life, they go to their primary doctor, and they have anxiety. Like they may be experienced bereavement, and that is experienced like anxiety. So they might give them a benzodiazepine, which works just like alcohol in the brain, which would reignite their addiction to alcohol. But also people through isolation and loneliness in the evenings, like they have a glass of wine, and that glass of wine may turn into 2 glasses of wine or 3 glasses of wine. And as that relationship grows, so does their diminished relationships with other people in their family. So yes, that could happen very quickly.
Okay. Is addiction of whatever type also tied to depression?
It is and it is not. Some people drink because they're depressed, and that may be like the secondary problem. But when people are depressed, they're finding out, most of the studies with people who've had congestive heart failure that are coming back who were given medications for depression are coming back more for social isolation. So when people are isolated, they're doing less, they're having more drinks, then they're more depressed. Okay. So
vicious cycle.
It's a vicious cycle.
Oh man. So, and also I suppose with addiction, determining whether or not something's going on, we shouldn't jump to conclusions either, right?
Absolutely, you're absolutely right. The first and primary thing to do is to go to your primary care physician and make sure you medically rule out that there's a drug interaction or a urinary tract infection or something going on that would push you to believe it's something other than what it is. And so after you rule out all the medical reasons for depression, then you go and get a psychiatric evaluation to make sure what's really going on with that patient.
Okay, great information for us today. Addiction in older adults is a serious issue. Follow Renee's advice and be honest and open with your doctor. And for help, use the information that's coming up next. My thanks to Renee for joining us today.
Thank you. I appreciate it.
For more information, call the Center for Lifelong Health at University Hospitals at 844-312-LIFE. That's 5433. Or visit www.uhhospitals.org/lifelonghealth.